Type 2 diabetes affects almost everybody. It affects the young, it affects the old, it affects people of different ethnic persuasions, it affects most Americans. And so this epidemic is an epidemic that touches many communities.
When you get to older age populations, then it's up to 25% of people over the age of 60 have type 2 diabetes, and another amazing almost 50% have prediabetes or at risk for developing type 2 diabetes. The longer people delay initiation of treatment or initiation of adequate treatment, the greater the risk of developing complications. So waiting until there's evidence of nerve damage, waiting until there's signs of kidney impairment, then it's almost too late to reap the benefits of more intensive glucose control.
It's hard sometimes because you're not going to become the favorite provider for the patient when you tell them that, look, you have diabetes and this is the step that we need to take to make sure you do well later on.
In the Bronx, we have one of the highest rates of diabetes of the 5 boroughs. And one of the reasons is that we have a lot of the risk factors. So we have people who are overweight and obese. We have people of certain socioeconomic stratas that are more at risk for developing diabetes.
And so changes in eating patterns, food consumption, availability of cheap, high caloric density food, fast foods, more sedentary lifestyle, fewer and fewer people exercising or even doing work that's required for physical exertion. These lifestyle changes and availability of food have really predisposed some people to massive weight gain, and that's really the single largest factor that's contributing to diabetes.
The American Diabetes Association recommends screening patients who are at high risk for diabetes.
So patients who are over the age of 45, if they are Latino descent, Asians, China, India, so any of the Asian countries, or for Latin America, African Americans, they have a higher risk, Indian Americans also.
Many people do have family members with diabetes. That's one of the things we're seeing, particularly for type 2 diabetes, is that we're seeing that diagnosis being done earlier. So there are adolescents and teens who are getting the diagnosis of type 2 diabetes. And as our population ages, we're seeing many more people who are older who also have the diagnosis of diabetes.
I think it is a problem because, it is a chronic disease, and the patients, they don't want to know. If you find out that you have a disease like diabetes, it means that you're going to have for the rest of your life.
It is a challenge because it affects so many aspects of someone's life, right? It's not simply medication, but diet, exercise, glucose monitoring, many health screenings, treatment of associated conditions like hypertension and lipids.
So we need to be conscious when we see these patients that we are screening them for the disease, so we can give them a better chance of fighting this long term. We also see a problem in the community where patients are told they have a touch of diabetes by their provider, a little bit of diabetes, a little bit of the sugars. So we need to be careful when we tell patients that they have a little bit of a disease. The guidelines are very clear. You either have it or you don't. And if you have it, let's have that conversation.
It's important for people to recognize if they have prediabetes because there are some fairly simple things that can be done to reduce risk. The number one thing being lifestyle change, weight loss and exercise.
I think for many people with diabetes, there's this issue of being judged. And I think it's not only from family members and community members, but it's also from the provider. And so I have patients come in and say, well, that was a bad number. And it's not a bad number. But there are targets that we want people to get to, and really focusing on getting them to the target, not a bad number, and therefore I am a bad person, being the focus of the interview and exam.
There's a lot of stigma that comes with that because if you have diabetes, people think that you're lazy, that you're not exercising, that you're not eating properly, and that is not true.
Yes, there's an association between obesity and diabetes, but most people who are overweight do not develop diabetes, right? Diabetes is a real disease, it's a real condition, has multiple factors that are responsible, including genetics.
Primary care, they need to understand that our patients, they want to get better. If they showed up at your visit, that means a lot. That means that they want to, get better themselves.
Please join us next time when the diabetes experts discuss strategies to help patients meet management goals and adhere to treatment.